Okay, I'm Justin, and welcome back to Questions with Deanna. Welcome, Deanna.
Thank you.
Now, we've talked a lot about in previous questions about the conscious diaphragmatic breath and how paramount that is for health and for the practice of block therapy. How does the breath component of block therapy set it apart from many other self-care practices?
I think this is probably the most significant pillar of the three pillars of block therapy, tied into the releasing of adhesions, because really, if we are conscious breathers lifelong, then we are feeding and cleaning every cell in the body lifelong. But again, because of gravity and the asymmetries that occur, we end up tipping off balance, and then the rib cage collapses into the core, stopping the diaphragm's ability to do its job properly. So it's amazing because in Yoga and the Quest for the True Self by Stephen Cope, he shares that when we breathe diaphragmatically, we feed the body up to 600% more oxygen. And I remember sharing this once, and somebody said, that's impossible. There's no way we can pull 6 times the air into the lungs, but it's not about that. It's about where we're directing the air. So at the base of the lungs here, which is right above the diaphragm muscle, is the majority of the oxygen receptor sites. When we breathe through the belly, we are pulling the air deeply into the lungs so that we have optimal absorption of oxygen. When we're breathing through the muscles of the upper chest, we're not able to pull the air down to that bed of abundance. So the amount of absorption is minimal. And that's where that 6 times the amount really comes in. But also that full exhalation, when we're inhaling, I'm going to bring my camera down one more time. When we inhale, this plate of muscle moves down. When we exhale, it moves up, and it acts like this pump inside the body. So the diaphragm is the ceiling to the abdominal organs and the floor to the heart and the lungs. So again, if we're collapsed, because if we don't train that diaphragm to be strong, it now becomes this weak foundation and allows the weight of everything above it to collapse into the core, which displaces the belly. People tend to feel that as we get older, it's harder to keep our proper size and shape. It's not because of fat accumulation as much as it's because of collapse, ballooning, and then the resultant toxification. So to train this breath and to really focus on that exhalation helps to move that negative energy out of the body, all those toxins, again, those byproducts of functioning, the carbon, it helps to move it out of the body so that we can stay properly fed and clean. And if we're not releasing the adhesions in the core and the rib cage, we won't be able to access that breath properly. So that is what really sets this work apart, in my view, from other practices, because there's no understanding of how to release those adhesions all the way to the bone. It's a 2,000 pound per square inch seal, but it's a magnetic seal. So we need to understand magnetics and how to release that magnetic seal. And if you think of 2 magnets far enough apart, they don't really have an attraction toward each other. Get them close enough together and they seal with the force. Now try to pull them apart. It's almost impossible, but you can slide them apart with ease. So with our process, we're really following the Fibonacci sequence, the pattern of everything that is created in nature, the spiral pattern. This is the Fibonacci sequence. The Nautilus seashells, the galaxies, the way our bodies form, but also the pattern that our body ages. We don't just linearly compress, we literally wind down over time. So to be able to really tap into the adhesions through the layers of fascia to get to the root at the bone, we need to follow that same pathway. And we also need to use a tool that is similar in density to bone in order to be able to get to that depth. Something that's going to be more porous is going to keep us more on the surface. So that's some of the reason why it's so key to understand the component of the breath, but also how to release the diaphragm in order to optimize this process.
Yeah. And when you put all that together with that greater access to the diaphragm and the importance of breath, and you really start to dive into some of the reading, like you read James Nestor's book, Breath, and how people can transform their health and their life with just their breath. It's phenomenal. And if there's one thing people can do, I think, or take away from this, it's really to tap into their own breath for their own benefit, which will change so many things. So,
well, and I remember when I was young hearing that they said that we only use about 10% of our brain. I really feel that we're only oxygenating 10% of our cells. And that's the reason we're only using 10% of our brain.
The potential that exists there is huge.
Yeah.
Yeah. Awesome. Thank you very much for that. Can't wait to get to the next question.
Thanks, Justin.